have heard a term called fake claiming. This is when somebody is called out, in this day and age on social media, for being a fake or a fraud in how they present their mental health symptoms. People with dissociative identities or a variety of dissociative disorders seem to be the most susceptible to being fake claimed. And sadly, this is not just by members of the general public, it can be by members of the clinical professions. This persisting narrative that people with dissociative disorders are somehow faking it is one of the greatest barriers that people in the dissociative disorders community experience when accessing quality treatment. And what's sadder is that even many trauma therapists or therapists who do not doubt the existence of dissociative disorders are now some of the ones doing the fake claiming. If content creators or people coming into their offices don't present in the way that they think dissociative disorder should look, there can be this automatic tendency to say you're faking this or you're doing this for attention. And my friends, these are issues that as a professional community, we really need to explore. I'd like to invite you to a free webinar that I am doing, sponsored by Academy of Therapy Wisdom, on August 1st at 11 o'clock Eastern. The title of the webinar is quite simply called Not Faking It. And we'll be unpacking a lot of these issues about whether dissociative disorders are real or not. Of course they are. And what exactly constitutes a dissociative disorder. We'll be looking at how media stigma can play into some of this and how a lot of just myths and old biases are still running the show, even in professional treatment communities. We are Dr. Jamie Marich. We are somebody who not only has a dissociative disorder, we've lived with it and have navigated it for most of our life. We are also a clinical professional specializing in the treatment of dissociation. And the work that I've been doing in these past few years and that I am happy to be continuing with Academy of Therapy Wisdom is really offering our professional community, my professional community, a chance to get an insider's view, a chance to hear what somebody with a dissociative disorder, with dissociative identities, actually has to say about the way dissociation is being treated and portrayed in the larger clinical professions. And hopefully we'll just have some fun and get real as we look at what it really even might mean to fake it.